Hi, everybody. So I'm going to go ahead and get started on how we should be annotating this article. So the big thing that we're looking for is words that we don't know, and we're going to circle those. And we're also going to be looking at what stands out for us in regards to um, the whole idea of can you save lives and the economy, or picking a side there. So my side is that we should prioritize life before the economy. You might have a different idea, and so you might think that the economy is more important. So the way that I'm annotating this is I'll try to do both sides, but keep in mind that if you have one specific side that you're taking, that you're going to want to look for annotations that do that. So up here in the Edge browser, like my last video showed, we're going to click this little pen, and then we're going to go ahead and start. So fighting COVID-19, can the U.S. save both lives and the economy? And this is done by PBS. While daily routines and regular paychecks have come to an abrupt halt for millions in the United States as a result of the novel coronavirus outbreak, the U.S. economy and most American households are under incredible strain. The pressure to get back on track in the middle of a pandemic that has not yet peaked is enormous, but so are public health perils. So I'm going to underline that because that seems interesting to me that it hasn't peaked yet. What does that mean? If we prioritize health over the economy, or vice versa, what are the costs? The number of jobless claims on Thursday hit a record high, and Congress is poised to pass a massive emergency stimulus deal just to keep money flowing. At the same time, the US now leads the world in the number of virus cases, according to one estimate. And I would say, I wonder why. Oh, that looks terrible. Let's erase that. And then I'm going to use this little note thing here. Why do we have the most cases? So I'm going to pause for a minute so you can copy and do the same thing. I'm going to drink my coffee. And Doreen would probably be telling me right now that I spelled does wrong. Okay. And I just clicked it again to make it collapse. More than 1,100 Americans have already died from COVID-19 with no end in sight. The dilemma begs the question, do we need to choose? President Trump wants the nation to return to normal life by Easter holiday on April 12th, he said on Tuesday. So we didn't do that. He walked that back. So we could put a little note here. It didn't happen. I give it 2 weeks, Trump said during a Fox News town hall, suggesting a mid April end to social distancing campaigns around the nation that aim to halt or slow the spread of virus. But the deadline contradicts the guidance of public health officials who say the U.S. needs several more weeks, if not months, of social distancing to get control over this pandemic and avoid the worst case scenario for the nation's healthcare system. Trump's words deliver a highly dangerous message, said Lawrence Gostin, who directs the World Health Organization Collaborating Center on National and Global Health and the O'Neill Institute for National and Global Health Law. So I'm going to go ahead and highly dangerous message. So if you are in the camp that we should save lives, this would be a good piece of evidence. So far, more than 68,000 people in the U.S. have tested positive for the virus, according to the latest reporting from the Centers for Disease Control and Prevention. An estimate from Johns Hopkins University puts the number at over 82,000. So we might want to highlight this. That would be for both sides because we need to know how many cases we have, right? The president is being confronted with a false choice, said Dr. Harvey Feinberg, a chair of the National Academy of Medicine Standing Committee on Emerging Infectious Diseases and 21st Century Health Threats. Instead, Feinberg suggests the U.S. should save the economy and save lives. Work to reduce the risk of more COVID 19 cases and loss of lives by stabilizing public health, which would also ensure the economy could recover. I'm going to write here what, let's see here. should save the economy and save lives, work to reduce the risk of more cases and loss of life by stabilizing public health, which would also ensure the economy could recover. Avoiding a second wave of illness would mean not suffering a repeat of the current lost productivity and uncertainty. So my question would be like, what would happen if we don't, or how could this help? Because what we're looking at is they're saying that if we prioritize life, that that's going to help the economy. So how would that help? That would be my question. We need this intensified focus and all-out victory on the health front so that the economy can get back, be reinvigorated with full confidence, Feinberg said. But getting both positive outcomes is not that easy, said Emma Rasley, an economist at Duke University. So up here, we've been looking at doctors. Down here, it looks like we're going to have an economist who specializes in money, the economy, things like that. This is not just saving lives, period, she said. This is trading off lives saved now for life and health and basically pursuit of happiness in the years to come. The nation must get back to normal as soon as possible, she argued, to avoid long-running consequences. And I'm going to put here, and this is my question to you guys. What consequences do you see right now? Is your family out of work? Are you having trouble finding food? Things like that. So I'm posing that to you so you can kind of think about it. All right. See if it's going to let me. There we go. Ah, no, it's not going to let me. Okay, so we're going to have to save this page. I would save it to your reading list. And then let's go ahead and close this. To reading list, save, and see if it's going to let me. Why are you doing this? Okay. So now we can close this. And let's see if it's going to let us go to the next page. There we go. Pen again. So she's saying that it could impact long-term health if the country sinks into a deep recession. So I'm wondering what she means by long-term health. 'Cause that's interesting, right? We have doctors saying that it's better to fix everything now, and then she's saying the long-term health of people is going to be affected by if we don't prioritize the economy. So the stock market has plunged in recent weeks, and roughly a fifth of Americans said they had already lost income or jobs due to the pandemic. According to a PBS NewsHour poll conducted March 13th to 14th, since then, several states and cities have issued stay at home orders, closing non essential businesses to contain the virus and putting more people out of work. I'm going to put it here. I have seen a lot of businesses closed and hurting for customers. I've even seen a couple that have said that they have closed down, right? Because of a result of this, because if they don't have money coming in, there's no way for them to continue. My son's gymnastics uh, suffered a lot because they had to shut down, right? I mean, they can't have 20 kids in a huge room and all these parents and stuff like that. So they had to close down, but they are really hurting. They had to ask for a loan and things like that to continue. Okay. More than 3.3 million people filed initial jobless claims between March 15th and March 21st, according to the Department of Labor Thursday, marking the most initial claims made in a single week in history. I'm putting history making moment. This is important because this is something that most people have never seen in their lifetime, right? And multiple lifetimes. Nearly every state blamed the pandemic for the spike in unemployment, the department said in a press release. If true, this rise would crush the nation's 3.5% jobless rate that preceded the arrival of the virus. Should the U.S. heed the Easter deadline that Trump suggested? If the very famous curve will be flattening, by then Brazel said she would defer that call to uh, epidemiologists and medical professionalists. So that's going to be epidemiologists are people that specialize in viruses and things like that. So I'm going to put here, and I'm curious if you guys know what the flattening the curve means. If you do, put your answer in here. If not, we can look it up, or you should look it up. Health economist Michael Chernow had a somewhat different take. If the U.S. were to allow the virus to spread, unchecked by social distancing measures, the economic consequences could be massive, both for the health of Americans and the health of the economy. It's probably better if we shut things down stronger and sooner, said Chernow, a professor of healthcare policy at Harvard Medical School. He believes that even if the government relaxes social distancing before the outbreak is under control, people will naturally pull back and avoid restaurants, movie theaters, sporting events, and more to avoid exposure and potentially needing medical care. You'll have some version of the exact same economic impact that you would have had if you had just shut down everything. What do you think? Do you believe people will automatically socially distance if the government lifts these controls? I want you to answer that. If you don't have to type this in, you can just write your answer in. I don't think I would, but that's my opinion. You might have a different idea. Too soon to talk timelines. For months, the US has had far too many diagnostic test kits, far too few diagnostic kits to help health officials determine who is infected with novel coronavirus and where COVID 19 is spreading. As a result, the country was slow to recognize the extent of the outbreak and to start mitigation strategies such as social distancing. So it looks like our first case was in January, and we didn't start socially distancing until what, like March. So with that, and we're still don't have enough test kits, so we still don't know how bad it is. And so it's a real tricky situation. To slow the rate of new infections and prevent hospitals and clinics nationwide from being overwhelmed by a surge of patients sick with the virus, public health officials say these measures will help flatten the curve, which spreads out the number of people who are sick over a longer period of time and reduces the kind of avoidable fatalities and catastrophic outcomes that Italy faced when COVID 19 cases strained its medical system. So now I want you to look at here. It says flatten the curve and it's in blue. If you click that, that will actually take you to an article that should explain flattening the curve. So I want you to do that after this. The U.S. is slowly ramping up testing capacity, but people across the nation are still reporting their struggles to get approved for a test. Without more tests, the U.S. doesn't have accurate data, and data and evidence should be the basis for any timeline for dealing with a public health crisis. So this could be one reason against opening. We don't have enough tests, so we don't know how bad it is. So we can't, uh, confidently guess what's going to happen if we don't have enough tests. So if you are in the camp that we want to keep it closed, you want to use this one as I would make sure you highlight in here and find a piece of evidence. Over here, I'll put actually probably up here. So this would be one reason for opening, right? Because if we're going to be facing long-term health and a deeper recession, that would be a reason, the other reason, right? Okay. Wynn says it's premature to talk about scaling back public health efforts now, adding that economic recovery is lost if tens of thousands of patients lay dying in hospitals overrun with no sight. The solution to the economic crisis is to prevent the public health crisis from turning into a societal catastrophe. Catastrophe. There we go. Sorry. Even Miss Seymour has issues reading stuff. Okay, so I'm going to save it to OneNote again. I'm going to click that, close it. This should be our last page. There we go. Pen again. To prevent the new virus from breaking the nation's healthcare system, the American Hospital Association, American Medical Association, and the American Nurses Association pleaded with the public in an open letter Tuesday to stay home, which they said is our best defense to turn the tide against COVID-19. So here you've got another reason. This would be a reason for staying closed. And this is basically all hospital workers are asking people to stay home, right? You type that in if you are in that camp. Physician, nurses, and healthcare workers are staying at work for you, the letter said. Please stay at home for us. If social distancing measures are lifted too soon, data suggests the U.S. would suffer a resurgence of cases, as well as patient hardships and even avoidable deaths. The WHO's Gostin said. He called the Easter deadline artificial and warned it could badly backfire in large part because it does not have sound scientific support. So, with that, our president did walk that back. He did not do the Easter deadline, thank goodness. And we're still not, he hasn't given a date yet for when, if we're going to open or when. Having a national goal of relaxing mitigation measures could significantly amplify the epidemic in America. So basically, if we start to release these, then it could increase the amount of cases that we see. The path to recovery, according to health experts, to gain traction in the fight against COVID-19, Wynn said that the U.S. needs to do three things it's not fully doing right now. She would expand the healthcare system to handle a flood of COVID-19 patients with adequate supplies for both those treated as well as healthcare providers. Social distancing measures should be brought in. So this paragraph, what they're saying is basically we should have a better healthcare system so that we can provide care to everybody so that people are not scared to go to the doctor because they don't have insurance, things like that. But you could take this and put it either way. For opening, you could say, we don't have a healthcare system to support social distancing, and people need to work for their healthcare. Okay? Against, and remember, if you're for, you're going to put the for. If you're against, you're going to put the against. We need a better healthcare system. So basically, it's going to be similar. We don't have a healthcare system to support or cases we have, and so and social distancing is our only option. I took the same piece of evidence and flipped it. For, we don't have healthcare system, so we need people to go to work so they can get their healthcare, so they can take care of this. Against, we don't have a healthcare system to support the cases we have, and social distancing is our only option to prevent them. So you see how I did that? I did for and against based on one piece of evidence. So you can always argue one or the other. Feinberg echoed that the nation should rev up testing kits to monitor where the disease is occurring, but he also went further, recommending that the country must adopt a far more aggressive approach to the pandemic, as if we are in a war to win, he said. Trump should appoint a commander who can capitalize on civilian and military resources with state level support. So, in here, most other countries have put troops on the ground and are preventing people from leaving their houses. That's how China and Korea really got their stuff under control, was that you could not leave your house under any circumstances. They were spraying disinfectant down the streets. They were dropping food off in front of your house. You'd open the door, grab it, go back in, and that's it. And you could not leave ever for no reason. And if you did, you were arrested. I think Italy's done the same thing. So that's where they're talking about more of a military approach to this. Uh, However, in our country, we already are seeing protests to this, so adding would probably be real difficult. Okay. Healthcare workers must have enough personal protective equipment such as face masks, respirators, gowns, and gloves so they can safely monitor and treat patients who are or may be infected. We would not send soldiers into battle without armor, and it is just inappropriate to send healthcare workers. So, right here, we have been seeing a lot of people on social media talking about how they don't have enough face masks. Um, a lot of nurses are now having to use cloth, which is not the same as a medical grade. So that could be something that you could choose how you would want to use that information. Maybe that's something that you're going to use for or against. I'll leave that one up to you guys so you can do that one on your own. Businesses want the government to contain the pandemic, Gostin said. After that happens, he said the economy should snap back. So you could use this for a for, um, or against, probably against opening, that the economy should snap back. All right, we're going to click save again into OneNote. It's all saved. Click close, and we are done annotating our article. Please make sure that you fill in everything on your PowerPoint and that you do your soapstone for this. That's going to be important because we want to make sure, like, who is writing this? Why are they writing this? That type of thing. Okay. Thank you so much for watching, you guys, and I will see you either this week or next week. Have a good weekend.